Hi, today we are talking about the top 10 facts about stem cell in 5 minutes. This is the first video about 5 minute series in which we will talk about briefly stem cell based on evidence-based knowledge in the public domain. If anybody wants to know about the stem cells, these are the usual top 10 questions which comes into the mind. What are stem cells? How they are different from the normal cells, their types, sources, what happens with the age, how they are helping in osteoarthritis, is there any evidence whether they are effective, safe, and what are the other area in which they are being tried or used. So what are stem cells and how stem cells are different than the normal cells? Stem cells are different than the normal cells in three ways. They are unspecialized or undifferentiated cells, which means they don't have any tissue or a cell specific functions. They are unspecialized. But when the need arises, either under physiological condition or under experimental conditions, they are able to self-renew. They can divide and multiply for longer period. And when a stem cell divide into two daughter cell, they may remain as a stem cell or one of the daughter cells may convert into the other cell type. This process is called differentiation. So it's a multi-step process in which a unspecialized cells become a specialized cells which can perform a specific function like fat cells, cartilage cells, or bone cells. Now, when stem cells are taken from your own body, then they are called autologous. And now we know the stem cells are commonly seen in many different parts of our body and organ. And common area is the bone marrow, adipose tissue, fat, dental pulp, and skin. And now we know they're also there in the heart and the brain. When they are taken from a donor like umbilical cord or amniotic, then they are called allogenic stem cells. What are the types of stem cells? So we need to know there are basically two type of cells, stem cell are there, embryonic and adult. Now embryonic stem cells are the cells which are usually present in the inner lining of blastocyst, which we see in 3 to 5 days of the early embryo. And because of this, they have a greater capacity of the cell renewal. They can divide for long time, usually like 6 months and sometime more than 6 months. They are pluripotent. Pluripotent means they are able to convert into any cells type of an adult body, but they cannot form a full organism or the full human body, but they can form any cells of the adult body. Now the adult or somatic stem cells, any cell which is beyond this first 3 to 5 days of the initial embryo is actually adult or somatic stem cells. They have a limited capacity for cell renewal. After a certain time, they stop dividing and they are multipotent, which means they can convert into several other cell type like fat, cartilage, and bone. Then the third type is called induced pluripotent stem cells. These are genetically changed or programmed adult somatic cells which behave like a embryonic stem cells. And now the research and interest is more into induced pluripotent stem cell. Now, if we see the number of stem cell, particularly the bone marrow drive, as you grow old, the number decline. So when you are newborn, the number of bone marrow drive mesenchymal stem cell, they are 1 in 10,000. But by the time you are 30, it drops to 125,000. And once you are above 50, it is 1 in only 400,000. Now, if we compare with the fat cells, studies show that their number don't change much with the age and they are quite stable and they are able to divide and convert into other cell at a faster rate than the bone marrow derived stem cells. In equal number of bone marrow and the fat, the number of pluripotent cells are 500 to 205 times more in the fat than in the bone marrow. But these two issues are still debatable and research is going on. In osteoarthritis, actually, there is an imbalance of tissue formation, which is anabolism, and tissue degradation, which is catabolism. Although it is supposed to be an inflammatory disease, but now evidence shows that there is some inflammatory component in osteoarthritis also. Cartilage breakdown and matrix also break down, and which lead to pain, swelling, and reduced movement of the joints. Quality of the life become poor, and in the end stage the joint becomes stiff and deformed, and there is a bone loss. How stem cell work in osteoarthritis? Well, stem cell now research have been shown that they work by paracrine and juxtacrine, which means they release certain soluble factors which act in the local environment. They release cytokines, growth factor, and exosome, and those factors actually they bring down inflammation. They promote new blood vessel formation, healing, and repair, and they also control our own immune mediated damage to the tissue or degeneration, and which ultimately lead to improve in pain symptom, quality of the life, and the functional score. And many studies show that there is a potential that they remodel the cartilage and also regenerate, although in a limited way. So this is a picture showing how stem cell work. They have by immune mechanism and by trophic like certain growth factors. The usual number of stem cell which have been used in various studies, they range from like 2 million to 1 trillion. Although studies show that even 2 million are as good as the higher dose. But when you go give a high dose, the results are better and they are long lasting. Animal study shows if you give very high dose, then it leads to free body scar formation. Usually in osteoarthritis, 1 to 3 injections are effective. Is there any randomized study on stem cell? Yes, this was published in 2019 by Julian. They used the stem cell in 30 patients, divided into three groups. Control group only with conservative, while the two group with single injection or two injection with 100 million. And at 12 months, again, they show that the pain improved, function improved. And on MRI also they show that there was a modification of disease, and they recommended it is safe and effective. Is there any long-term follow-up? Yes, this is 96-week follow-up. Adipose derived stem cells. Again, they divide into three groups, low, medium, and high, and it showed that it is safe and effective. Are there any side effect? Yes, every treatment has side effect. In stem cell therapy, in 50% of the patient, it just causes mild pain and swelling, which usually subside in 1 to 2 days with minimal amount of intervention in the form of paracetamol, 1 gram 12 hourly. It resolves the symptom. Serious complications are very rare and they are not directly related to the MSC treatment, like the stem cell treatment. Does it make any change in the imaging? Most of the studies show that the X-ray may remain same, but recently few studies have shown that it does improve the joint space. Same with the MRI. Now evidence show that there are some changes in the cartilage on an MRI. Edema may be less, there may be increased cartilage thickness, and we see these changes at 1 to 2 years of follow-up. So this was our small video with evidence and fact. If you want to know in more details, then on the same our YouTube channel, this is our playlist which show the detailed stem cell video, myth, fact, and confusion. Each presentation is about 30 to 40 minutes. If you have more interest, you can view these videos.